moving ahead. Joining us now is one of the authors of that study, Dr. Dena Goffman, Chief of Obstetrics at New York Presbyterian Hospital and Columbia University Medical Center. Dr. Goffman, thank you so much for being with us tonight. I really appreciate you making the time.
Thanks for having me.
And I know that I am the one extrapolating from your data to talk about what this might mean in the larger population. I know that your study is not something that directly relates to the larger population, but aside from me making that extrapolation, is there anything that I explained there wrong or that I misunderstood about what you and your colleagues have done?
No, I think you captured it exactly right. We started, again, as you mentioned, March 22nd, and that was really after we had an experience where we had 2 women admitted for routine OB care for labor and delivery, and those women were asymptomatic, really felt well on admission, but then developed symptoms and became quite sick during their admission with us. At that point, we had no suspicion for coronavirus or COVID-19. Therefore, once we made the diagnosis, the women had been under our care for a period of time and had potentially exposed numerous staff members, a huge portion of our workforce. And then once we made the diagnosis, it sort of clicked that there were women who may be asymptomatic and that we may want to think differently about it. So we were able to embark on the universal screening. The study that you cited is an early experience. It's only 2 weeks of data, and we will certainly continue to collect and further publish on that data, but it really did show that 13.5% of women showing up feeling well to have a baby were coronavirus positive.
That's remarkable. So just to be clear, when you had those initial cases that led to you starting to do this universal screening, it was in part because you realized that you needed to have universal testing of women coming in for labor and delivery because so many of your staff could potentially be exposed per one patient if she ended up being infectious.
That's exactly right. And there are actually a number of other things that we can do differently if we have this information about our patients. So we can do different isolation practices. We can use additional precautions. We can do better things to care for the mom in terms of following her closely to look for symptoms to perhaps develop. And it can also help us take better care of her family and her baby to keep the baby safe. So having this information actually has numerous benefits for us and for the patient population.
And again, I know that is exactly what you are focused on, and you are not trying to do a prevalence test of the New York City population. And I'm the one who is making that leap. But I just have to ask you if it is a surprise to you and your colleagues to learn that you've got 14% positive test rates among what should probably be a pretty standard snapshot of women of childbearing age in New York City. It just seems like a phenomenally high number to me. I don't know if it surprised you when you started to realize how high those numbers were going to be.
I think we were curious and we weren't sure what to expect. That was why we wanted to get the information. Now that we've found this, it's certainly concerning that we have 13.5% of our population who are coronavirus positive. I think we don't know exactly what it means for the general population. These are all female patients. They're all pregnant and they're relatively young and healthy. But I think the unique thing here is that we have patients who need to access the healthcare system. As you mentioned at the beginning, they can't stop coming. They still need to come in to deliver, to have their babies. And we really did have an opportunity to test this sort of patient who are not presenting to the hospital for coronavirus-like symptoms.
Dr. Dena Goffman, Chief of Obstetrics at New York Presbyterian Hospital and Columbia University Medical Center. Thank you to you and your colleagues for going to work every day in trying circumstances, also for innovating and recognizing the opportunity here scientifically to take this really incredible snapshot of that population. Thank you for your work. Thanks for being here.
Thanks so much.
All right, we'll be right back. Stay with us.